Thank you, everyone. This is Dr. Frank McMillan, uh, Chairman of the North Andover Board of Health. It's May 7th and it's 7:09 p.m. and I'm going to call the meeting to order. First item of business is the announcement from the governor pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, general law, chapter 30A, section 18, and the governor's March 15, 2020 order imposing strict limitation on the number of people that may gather in one place. This meeting of the North Andover Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and guidelines for remote participation and/or requirements to attend this meeting can be found on the town's website at www.northandoverma.gov. For this meeting, members of the public who wish to watch the meeting may do so on their televisions by tuning to Comcast Channel 8 or Verizon Channel 26 or online at www.northandovercam.org. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite the best efforts, we will then post on the Town of North Andover website an audio or video recording, a transcript, or other comprehensive record of the proceedings as soon as possible after the meeting. With that being said, I'm going to ask Mr. Brian LaGrasse to give us an update on the COVID situation in North Andover. Can everyone hear me?
I can hear you.
I can hear you.
Is that better?
That's
All right. Sorry about that.
all right.
Let's see. So Massachusetts right now has a total of 73,721 cases. It's still increasing by between 1,500 and 2,000 cases a day. We did have a little dip the other day where there was only 1,000 reported cases, which was really low, which is really good. To put that in a context, the last time we spoke as a board was on April 23rd, and we had 46,000 cases on that day. So we didn't quite double this time like we did last time. However, it's still obviously picking up. It's still increasing by those number of cases per day, but it's leveled off in terms of total numbers for the past 3+ weeks. It's been about, like I said, 1,500 to 2,000 cases per day. So that's kind of plateaued. Right now, we've been hovering around 3,500 hospitalizations in Massachusetts, which is been level for just about a month as well. So that's definitely plateaued off as well. And that's some of the stuff that we were looking for and why we were doing all of this social distancing and the mask orders and things like that. Right now, Holy Family Hospital has 23 ICU beds taken. Lawrence General has 14 taken, so they've got a little bit of capacity left, which is good. The percent of positive cases jumped up to almost 30% yesterday. But I believe that was only because they did 6,000 tests in Massachusetts the day before, as opposed to about 10,000 2 days ago and 16,000 4 days ago. So lower number of tests, higher percentage of positives resulted in a little blip that kind of jumps up on the radar a little bit. Caroline will discuss the local numbers after I'm done. The governor did issue the all mask order that took effect yesterday. This does supersede the original order that we put in place for food and retail employees. It's more strict and it's obviously more inclusive of everybody out in public. Let's see. This week, the governor also did relax some non-essential business restrictions, which allows some businesses to call in employees to fill online and over-the-phone orders for delivery or shipping. So they had a list of criteria out with that deals with the number of employees allowed per square footage of the establishment. And there are 3 criteria for that. So if they meet those, they can open up shop, have employees come in and ship or deliver their products. The governor also allowed golf courses to open up as of this morning. It's funny, they actually attached 19 conditions that golf courses must meet, but they are allowed to open. So it's your basic stuff for the golf courses. Just to give you a quick little rundown, it's, they're not renting carts, the pro shop's not open, the restaurant's not open. You have to book everything online. You have to pay over the phone or online. The tee times are spaced out 15 minutes apart. You wait in your car until 15 minutes before your tee time. Then you can go out there. There's no loitering after. You can't hang out in the parking lot after. Stuff like that. So they took away the rakes and the sand traps. So there's no cross contamination of things and transmission of the disease. So right now we are beginning discussions centered around reopenings of various entities. We're in preparations right now about how to reopen town hall and town offices in the coming weeks. We've had preliminary discussions and the working groups are being set up to meet and go over everything that the facilities need to do, policies, staff, things like that. So that's just starting off. I'm going to get that up and running. I also met with a task force from Merrimack College and began discussions with them about this fall and even bringing employees back over the summer. And then obviously looking forward to fall students. But there are so many unknowns still, and it's just conceptual, but it's got to start now or else they won't be able to get it done in terms of any changes they're going to have to do in the coming months. There are so many logistics to this that it's definitely going to take some time to iron everything out. I mean, they're looking at dorms, classrooms, food service, sports. I mean, they have got a whole list of stuff that they have to try to figure out. Brooks reached out to me as well this morning, so I'm going to touch base with them to begin talks about how they're going to do that. They're going to look at the exact same stuff that the colleges and universities are, because they have dorms and residential students. I've also spoken to several businesses over the past couple of weeks as well about reopening guidance from us. Basically, my advice has been to businesses that if they're going to be reopening soon, they have to consider what their business is and how they can evolve or modify what they do and create almost like a new business model that can include social distancing, employee protections, consumer protections, contactless payment options, online bookings or orders, basically a self-evaluation of what they do and how they can change and evolve to meet what the new normal is going to be. Not everybody can do it. I was speaking to the owner of Restoration Barbershop just the other day, and it's a barbershop. So what can they do to implement some new practices when they can open up to increase safety and decrease potential exposures for their employees and their customers? And we had been talking a little bit about, like I said, the online bookings. For him, he talked about having his clients wait in the car. So there's no waiting room. There's no reading a magazine in the waiting room while you wait to get your hair done. Talked about distance between chairs and maybe even putting up dividers between, like plexiglass hanging from the ceiling that hangs down between the barber chairs. Master customers would have to have like ear loops because you can't cut a hair with a strap behind your head. Venmo, Apple Pay, things like that. So we're still waiting for info on what the state will do on the 18th. And when the 18th arrives, some businesses are allowed to open, some won't be. Then we'll be the ones to work with each and every business on how they can do it properly and how to meet those criteria. And then obviously we'll get plenty of questions about if this, then that, if we can do this, does that count? Things like that. I'm sure we're going to come up with all sorts of creative solutions to whatever requirements are out there. We're also working on the election. The election is June 2nd, and we're meeting and talking about protocols. And actually, we are meeting next week on that as well. But protocols for the poll workers, social distancing, the booth setup, mask protocols, things like that. And then I'll definitely have more updates on that as things get closer. We're also talking about town meeting as well. Get a meeting coming up next week to discuss town meeting and how that's going to look. That's been postponed until June 16th. So we get some time for that, but it's going to be right around the corner, and things have been moving so rapidly and things have been changing so fluidly that, from one day to the next, we're not sure what's going to be happening. So we just got to keep up with everything and keep trying to get out the right information and work with the different entities on how to do it properly. That's all that I have for now. I can pass it off to Caroline to give a local update, and Stephen as well.
Thanks. So as far as what we're seeing in North Andover, our numbers have been kind of waxing and waning. So like there are days that we see 18, 15 new cases, and then there are days that we see 1 or 4. And it really depends on what kind of testing is happening out there. Most of those big jumps that we're seeing are because there have been some long-term care facilities that have initiated on taking the National Guard up on doing site-wide testing. So they've tested, all staff, all residents, whether they're symptomatic or not. And so that's why we're seeing some of those larger jumps from one day to the next. So right now we have 235 cases in North Andover. About almost half of those are recovered and out of isolation, and then we have 15 deaths right now. Some of those are from home and some are from long-term care facilities. All of them are, I don't have the exact age, but I know, 70s, 80s, and above with, pre-existing conditions. And so we've been trying to stay up to date on all of the new and changing criteria that's being released from the state. They have changed the infectious period and the time that someone needs to remain in isolation. So for healthcare workers, it used to be 7 days from the date that they started with symptoms. And then they had to be like 3 days fever-free without, some improvement of their respiratory symptoms. Now they've extended that to 10 days in isolation, and I believe they will extend it across the board to everyone 10 days once the CDC does. So the reason for that is they have seen some viral shedding around day 9, and so they're trying to, capture that entire period and have people, continue to isolate. A lot of the symptoms we kind of see wax and wane. We have people who are having like really good days and they think they're, on the way out and recovering, and then they'll have a couple of bad days and then they go back to having a couple of good days. So by extending that isolation period, you're, not sending them back out into normal activities, and then they kind of have that dip again in their symptoms. So, and then I've just been working with cases and then also trying to help with resident questions and concerns. There's been some questions regarding antibody testing, and the state is trying to address those questions. So some of the concerns is that we're starting to see an increase in the amount of antibody tests that are coming, that are resulting. And so when we see a positive antibody test, they're treating it as like a probable case. And so their concern is that we don't know right now what that means. Does that mean that that person, is still at an infectious state? Does that mean that the person had some, immunity, and how long does that immunity last? So they're looking at a lot of different things. There's not a lot of clear guidance for us. So if we get a positive antibody test, we're treating them kind of the same way as we would a confirmed case with the PCR nasal swab. So, and I think that's pretty much it for me.
So go on to Steve.
Hey guys, so since we last spoke, I've kind of been doing some of the same things, still fielding just complaints that may come in, or just general questions and trying to respond as needed. I've still been trying to go around and just take a count at some of the public fields and spaces whenever I can, of just places where residents are exercising, like the Common and some of the high school fields. We developed a couple more PSAs we put out related to some of the things Governor Baker had put out So, for example, we put one out just related to the non-essential business extension, and then we put one out related to the mask and face covering order that came out on the 1st and went into effect Wednesday or yesterday. I sent some information out to some food establishments that may have voluntarily closed or altered their hours. And if they're looking to reopen, I've been trying to get in touch with them and hopefully do a pre-operation inspection before they get up and running. Just to do a quick check of the establishment, make sure it's clean, make sure refrigerators are at temps, things like that. And while we're on the topic of food establishments, I've been working with Megan Baldwin of SweetSafe, and we developed almost like a new inspection form for food establishments, so I can hopefully start going out again and getting into some of the food places in town. And the inspection form is a focus on COVID-19 to a degree, where we just kind of question them before we go in on like some of the stuff they're doing. Megan would give them a call, and then I'll go in a little later and just verify what they say as far as things related to COVID-19. So, for example, if they're staggering staff into different shifts, what they're using for disinfectants, things like that. And then also just checking some of the essential portions of food inspections, like cold hold temperatures, cleaning, how it looks overall, food, as long as it looks like it's not expired or it isn't being stored past expiration date. I've been trying to start helping planning, like Brian had said, for the reopening of town hall when that occurs, and then also just trying to get some ideas on paper for once non-essential businesses start reopening, and just brainstorming some stuff on that aspect. So that's pretty much been it for me, though.
All right, that's a great presentation. Let's just go around the board members and see if there are any questions. Joe McCarthy always has something intelligent to say, so I'm going to start with him.
Well, I'm not sure how intelligent it is, but I want to, instead of asking a question or questions, just go through the recent coronavirus test that I had. Going back about 6 weeks or so ago, I had symptoms of a cold. And recently I'm saying, well, that could have been the coronavirus. I don't know. So I had a test. It's an antigen test. And this is important information because there was a measure of confusion, and I had discussed this with Carolyn. So the first test that I had was an antigen test. Now, an antigen is a toxic foreign substance which produces an immune response. And that will let me or whomever has that test know if they are indeed carrying the virus and can contaminate other people. They may even be asymptomatic, that is, have no symptoms at all. That test is a nose swab. And I had that test performed. I went to my primary care physician's office. He gave me a script, and I was told to go to Holy Family Hospital. Well, I went to the wrong Holy Family Hospital. I went to the Holy Family Hospital in Methuen. It's actually the Holy Family Hospital in Haverhill. And I waited in line in the car, and I had the swabs taken. And about 4 or 5 days later, the results came back negative. But what I really want to know, what happened 6 weeks or so ago? Could I have had the coronavirus at that time and recovered? That is a different test. That's an antibody test. And I had, and that will say you had it. This is how it was explained to me, and you have recovered from it, so you are no longer contagious. Now, that's really not that consistent with what Carolyn was just saying. Nevertheless, I had that test performed. I had that performed at Quest Diagnostic in Methuen, right adjacent to Holy Family Hospital. If you go on the website, it says that they don't collect active samples. Well, that means swab testing. So they don't swab, but they take blood. They take a blood sample. So I'm going to have to wait. I thought the results would be back. They said it'll be about 24 hours or so, and that was early yesterday. So I'm going to have to wait further. I checked online about a half hour ago. I don't have the results. So again, 2 tests. One is, did you have it and perhaps recovered from it and are not contagious? And that's the antibody test. And the other is the swab test. Do you have it now? And are you contagious now? Now, my question is, how good are these tests? And again, there seems to be a measure of confusion, even right now, from what I was told and as presented by Callan. And I trust her more than what I was told, by the way. How good are these tests? Does anybody know?
No
So-
perfect test, Joe.
But
I've been
that's-
told by the state that like the swab test is pretty sensitive to picking up the virus. However, there's a technique with the test. And so if the swab isn't done, accurately, that could result in a negative result. But as far as percentages, I don't have a percentage. I just, get my information from them, and they say, it's pretty sensitive as far as they see more false positives than negatives, but I don't have any data to, back that up per se, just based on what they say, when we do our conference calls and webinars. The antibody tests, I think from what I've heard initially, that they're still kind of developing them. And right now they're not the greatest of tests, but again, I don't have like data that backs that up and, percentages as far as results and false or negatives or positives.
Thank you.
You're
Oh,
welcome.
by the way, when I had the test, I asked if the town nurse would get the results, and I was told no. But you said you do get the results if they came back positive.
Yes. So I get the results if they are positive. So if you test positive with the nasal swab, which is the, active, are you actively infectious? If it is positive, I do get the results, some more timely than others, as I was finding out today. And then with the antibody test, if it does result positive, it is considered a probable test, not a confirmed positive. So it doesn't actually count towards our numbers or towards, but we still have to track those probable results as if they were, positive.
Because
The
it's probably
system-
not definitive, is it even worthwhile taking it?
So I think I would think that there's some value to it in certain circumstances. For instance, if you had someone in the house that, was a confirmed positive, they tested positive, and then someone else in the house developed symptoms, but was told, by the doctor, oh, you probably have it, you don't have to get tested, and then like a month or two later decides to get the antibody. Was it really that, or was it like the flu, or, so I think there's some value to it. I just don't know how accurate the test is and what, what the, accuracy is of it. So I guess I think it's still being, the jury's still out.
In the antibody test, I was told that indeed, if I had it 6 weeks or so ago, I don't have it now, and I am not contagious. But that's really not quite the same as what you were saying, Ellen. So
I think it's based on if you have symptoms that you can identify. So there are some people who are getting antibody testing done who have never had symptoms. So 6 weeks ago, 10 weeks ago, 4 weeks ago, they haven't had anything. They're just kind of curious, was I an asymptomatic carrier? I'm going to check and see if I have the antibody testing. I think those aren't as clear as the people who are like, yes, back on March 20th, I had a fever, I had a cough, and they could identify a set of symptoms. But I think it's the asymptomatic people who never had anything and just wanted to see if they were exposed and had the virus.
Joe, it
Just
might
didn't
also
have
be
symptoms.
helpful in contact tracing. So when we get to the point further along in the pandemic, when we're trying to figure out who's been exposed, you might, even though their symptoms might have long resolved, if they have a positive antibody, you might want to screen people that they contacted with too. So, but that's a different discussion. I'm just going to move it along because there's other people who need to ask questions or maybe want to ask questions. I'm just going to go in the order of the appointments. Since you are the most senior of the appointees, Joe, you went first. I'm going to go to Michelle Davis next, who has moved up in seniority.
I was gonna say, that's pretty crazy if I'm next.
Yep.
I actually don't have any questions. Just kind of my normal comments to thank everybody on the call for all of their hard work. And I appreciate the updates and the planning, because I think it sounds great that we're thinking ahead and reaching out to all the different organizations in town who are going to need support on really trying to figure out what the next steps are. So just anything else I can do or we can do to help support that, because I'm sure there's tons of questions coming in.
Awesome. Thanks, Michelle.
Thank you. I'm going to go to Daphne next. Again, the order of appointment, no preference shown here.
You there, Daphne?
To unmute, you have to touch the circle, and then you hit the microphone button. Given that we have a learning curve, what we'll do is we'll let Daphne play with her controls, and we'll go next to Patrick.
Excuse me, that control is this star 6. I believe that's all you have to hit.
It depends if you're on a telephone, Joe, or if you're on internet. So I've got an internet.
Oh.
Okay, can you guys hear me?
Oh yeah, Daphne, go
There.
ahead.
Well, you didn't hear all my gibberish of saying that I hope you guys are staying safe, because I know a lot of you guys are in the front line. So that's first and foremost. And again, just to piggyback on Michelle, I hope I want to, commend you guys on all the great work that you're doing out there, and also for, doing it and giving us great updates. So my question is, are we going to, as the whole mask situation is made mandatory for everyone, are we going to do some education for our residents on, because I even had a case where in the post office where about social distancing and so forth, how people sometimes feel comfortable with children that for whatever reason, if they cannot wear a mask, and folks are approaching them where they're not, just being the mask police and so forth, or the social distance police. Is it possible to do some education on that for our citizens before, I think people are on edge and so forth. And I think some education on, when to approach someone or when to not approach someone to feel comfortable, and to kind of like educate. So I know they said kids under 2 years old don't have to wear a mask, but there was a case that happened to someone that I know where someone felt comfortable enough to approach someone that had a child and ask them about their mask.
Okay. We did send out a notice last Friday after the governor's order that had information on masks, his order, the requirements. We can do that again. We also sent information out on proper use of just PPE in general, how to make your own mask, stuff like that. So we're going to do an update again tomorrow, I believe. I can get that out with that update as well. And this goes out to all the town's social media, the Facebook account, Twitter. It's on our website. So we can try to get more of that stuff out starting tomorrow. So I think we have another update. We can get it out for you. But I agree. We've been trying to keep up with it. So
is there a way, Brian, to just make it known that folks are just to not feel comfortable to just approach a stranger and confront them about, because you don't know someone's situation pretty much. I believe that's something that the store's employees can do or management, but for folks to approach other folks, I feel as if it's going to get kind of out of hand.
Okay. Let's touch base tomorrow morning and we can work on something together and then get it out with our update tomorrow.
Wonderful. Thank you. But
Thanks,
again,
Daphne.
thank you so much. And I will talk to you guys offline about some other math stuff that I have for you.
Yeah, I'd appreciate that. That's awesome.
Thank you, Daphne. Brian, I think she brought up a good point. I don't think that individual citizens, if they see somebody without a mask and they're causing them to have anxiety, I think that the best move is probably not to confront the person and just create that 6-foot distance. I mean,
Okay.
I think that would be the smartest thing.
Yeah.
there's not always going to be somebody there to enforce it. And the other thing is that, if you do require everybody to have a mask, then there's probably some obligation to provide a mask to somebody who can't get one. And I don't know that we're there yet. So I think that there's an education component, and I think that there's also a common sense component where if you see somebody without a mask and you feel threatened by that I think that you're probably just better off to keep your distance from them rather than confront them.
And some people can't wear masks because of medical conditions, or we've had one person that was talking about claustrophobia. So there are conditions out there, and the governor's order does exempt medical conditions for wearing a mask, but we do have masks available at the senior center. The senior center has been giving them out left and right. They're the cloth masks you can reuse too. So they've been giving those out since day one. And we have more masks coming in all the time, which is really good.
Right. It's the same as kind of looking at somebody in a handicapped parking space who's not in a wheelchair. That person could have
Yep.
class 3 or class 4 heart failure, and you might not know that by looking at them, but you really don't have any business confronting them.
Yes. Yep.
Brian, you
So-
say that these masks are given out at the senior center. Is that the backside door? You just ring a bell and someone comes there, or you have to make an appointment to pick them up?
I would call to make an appointment, and they've been giving out 4 masks at a time. I know they were running low, but
Really?
I think they might be getting more in, and they were getting more in as well. I can check with Irene on that for you.
Yeah, a lot of the cloth masks are either being made by some of the seniors or they're being donated by residents who sew. And
Yep.
so I know they had a wait list at one point, but then, it kind of depends on where you get when you call them.
Yes.
I'd like to turn the floor over to Patrick, who has been waiting patiently with bated breath, and I know he's got something to say about this.
Thanks, Pat.
I actually have 2 things. I've never been so excited to hear about tick spraying, so I'm eagerly awaiting that. I actually have no questions, and I will give a shout out to a happy Nurses Day from yesterday to the nurses on call and to all the nurses on the front line. But I actually have no other questions.
All right.
So
Brian, I have a question for you, Brian. Another question. You mentioned earlier that by the new regs, there is a max capacity. You say people going to stores like Walmart and CVS and Home Depot and Lowe's and so on and so forth. I know Walmart is 5 people per 1,000 square feet. And these new regs, basically, they're talking about, well, up to 40% of capacity, whatever that is. I know
Right.
that, for example, yesterday I went to Lowe's in Danvers, and the line was to get in was at the end of the building, a long wait. And once you're in, I looked around, there weren't more than a couple dozen people there.
Couple
And I'm
thousand?
saying, well, what is this about? And furthermore, if you spend all that time waiting in line, that can only increase the exposure of the coronavirus, because people are waiting in line and they're looking at the plants and to either side of them and picking them up and moving them around and putting them in their cart or putting them back. And I'm saying this is crazy. It really, it's the same at Home Depot. Market Basket's not much better. Butcher Boy is not much better. Stop and Shop is not much better. So the limitations, from my perspective, draconian. They really are. But
Okay.
it is what it is.
Yeah, I know. And the limits they've been placing on this type of stuff has been on a occupancy capacity percentage. Some of the places that have done it themselves have done their own numbers under their own calculations. That's even actually less than the 40% occupancy capacity as determined by the building department. So corporations have done it themselves already. Butcher Boy did it themselves already as well. When these places start to open up again, there probably will be restrictions that are similar. The non-essential business criteria that they came out with for the new, for the relaxing of some of these non-essential businesses being able to operate was based on employees. If it's 10,000 and under square feet for a retail location or something like a florist, you can have up to 3 employees. 10,000 or 30,000, you can have 5 employees, and over 30,000, you can have 7 employees. But they're just packaging the merchandise to get ready for either shipment or delivery. Um, Moving forward, I think phase 1 will allow retail stores to open up, and they may have the same thing as the grocery stores were mandated to do 40% capacity by the last governor's order. So moving forward, I think that's where it's going to go. It may be draconian, and I think waiting in line, as long as you're outside and you're 6 feet apart and you have a mask on, there shouldn't be any type of virus transmission at that point, unless obviously you're picking up stuff in line and then transferring virus that way. But I think that's where we're looking, and that's where we're looking to go in the near future.
Brian, this is Frank here. I'm going to take the chairman's prerogative and ask a question since I made myself last.
All right.
So, my question to you is, we have our local Board of Health regulation, and we have the governor's orders, and we also have the town manager's emergency order.
Mhm.
Where do we stand practically on specific local Board of Health orders? Where do we stand on the town manager's emergency powers? And where do we stand on the governor's orders, with a particular focus on how do we unwind some of the things that we have done based on, good science and good evidence, so that they are effective at the least intrusive level?
Okay. The orders that you guys have done so far include the personal services order, which was prior to the governor issuing his essential versus non-essential business lists. So we went ahead and did the barbershop, salons, hair salons, nail salons, permanent makeup, tattooing, all of that stuff. We preempted the governor's order by doing it first. He then came in and went above and beyond what we did and did it across the state. So he has superseded our original personal services order, which actually expired April 7th. So ours is no longer on the books, but he has his in place that went far beyond what we did. So that one's already gone. The other one was the mask order that we did. That one did not have an expiration, but until the board decided to lift it, that was for food and retail employees in public facing spaces. The governor has also since, after we did that, gone ahead and did the entire state mask order, was obviously with exemptions and conditions, that supersedes our local Board of Health order. So we still have that in place. His supersedes ours and is more encompassing than ours. So you as a local board can do local regulations and local orders that are stricter, not less restrictive. So as of right now, the governor's mask order is more restrictive than yours, and it supersedes ours. I think it was even preempted in the language that was put out there. We're still responsible for enforcement and maintaining it, but his order does supersede yours at this point. The town manager's orders, I would have to check with her and Suzanne on that, but she has made the emergency declaration back in March. That is still ongoing until it's lifted. So for now, if you guys want to do something more restrictive, you have that ability as a local Board of Health. You just can't be less restrictive.
Right. So what if we want to not have our mask order on the book when the governor decides to lift his order? So I think it might be prudent for us to just set an expiration date for our local mask order, which is being superseded, but still make sure that when the governor decides to lift his order, that our order doesn't kind of still control that point, because then it would be more strict.
Correct. So right now, your order was effective beginning April 24th at 12:01 a.m. And it was written to say it shall remain in effect until the Board of Health, in its judgment, determines that the public health emergency no longer exists and terminates the order. Do you guys want to amend this and add in a date of June 1st, March 18th, June 21st? I mean, we can even think about it. We still have another meeting in a couple weeks that we can revisit this issue. We guys can think about it and propose changes.
Brian, you know what I would suggest is that we don't act on that tonight, but that we put it on our next meeting agenda list so that it doesn't get forgotten.
I would agree with that recommendation completely.
Is there any further discussion on that matter by any of the Board of Health?
Nope.
Okay, so we will put that on the next agenda. We have a meeting. Actually, that's in 3 weeks. Sorry. It is May 28th, is our next official board meeting. I don't believe the governor will be lightening up on this mask restriction between now and then. So I think we're safe to leave it on the table for the next agenda.
Okay, Brian, I want to bring up one other item, and this was just a discussion between Brian and myself. No others were involved, but we did have a discussion this morning in preparation for the meeting with regard to sanctioning people who don't follow the governor's orders. And the gist of the discussion is that we don't want to be in the business of punishing people. But at the same time, we do need cooperation of the public. So there's a fine line to walk to assure that the public and the department are in sync and that we maximize compliance and minimize conflict. And maybe we can discuss that for a couple of minutes.
Let me just throw in one point. So in the governor's order and what it gives us the authority for, he lists basically 2 criteria. A is a written warning for the first offense, and B, a civil citation of a fine up to $300 for the second and any subsequent offense. That's the same mechanism we use to issue fines for any other regulation violation we have. It's Mass General Law, Chapter 21, or Chapter 40, Section 21D, gives us a local authority to issue non-criminal disposition fines of up to $300. So like our tobacco tickets are under the same Mass General Law as would be this. Obviously, the intent is to just get somebody to comply and put a mask on if they're in public or going into a grocery store or going into a pharmacy. So that's what, so first offense, warning, second offense, and anything else after that, up to $300. And you guys can debate it, what you guys want to do, how you want to direct us to enforce this. So the floor is yours.
The first offense
Discussion.
may be above and beyond just a warning. If someone says, no, I'm not going to wear a mask, and you say, well, I warn you, you have to wear a mask, and I'm not going to wear a mask, then you're already up to the second offense, and the person can say, I'm still not going to wear a mask. Find me all you want. I don't care. I don't have to wear a mask. So I'm not quite sure how that's going to work out.
I think the goal is education and getting the information out there. If somebody has questions, we're there for them. Give them the information that they need as to why and the reasoning behind it. We kind of go from there.
A lot of Americans right now are getting antsy by all this, and we're seeing, well, there are protests. There's a protest in Boston, over 500 people, I believe, on Monday. And if the governor comes out with further delays and restrictions, I see the protest getting worse, perhaps much worse. So it's really a slippery slope here. I believe that what we've done so far has been wise and prudent. Going forward, really not so sure. And this is not the time to discuss that. It's more of a political discussion than something to be brought up at the Board of Health. But I'm just concerned. And, oh, by the way, and speaking of statistics, like Brian, you went over some statistics earlier. I read a report in Germany that they believe that the cases, and right now I'm looking at the Wall Street Journal, the U.S. cases are 1,223,000. In Germany, they believe that the cases can be up to 10 times greater than what they believe, because a lot of people have had it, particularly young people, and have had few, if any, symptoms. So that's interesting. There's still so much about this virus that we don't know, but up to 10 times, wow, scary.
Frank here. I actually find myself agreeing with Joe to some degree. I think that we're going to lose people if we come out with a regimen that people are going to be fine. At the same time, I think that a business owner doesn't have to do business with somebody who's going to come into their business, and if the business owner feels strongly that they want a mask because that's protecting his or her employees, then they have a right to do that, and they can deny that person service on that basis. But I think that we're going to lose people if we become too punitive. And I'm willing to hear both sides of the discussion. So I think it's a very fine line. I think we've actually been prudent about making recommendations and not hard, firm orders. I mean, we were firm about the employees of a business, but not necessarily the customers. The governor superseded us. Okay, that's the world we live in. But I don't think it's a crime for being. It's not a crime to be a difficult person, and I think we have to tread carefully. But that's my thought.
I'm going to agree with Frank on that. I think that as long as we continue the theme of just ongoing education and teach people why wearing masks are important, I think that's the best course of action. And I agree that more regulations, we're really going to lose people, and there's going to be more protests. So I would just favor ongoing continued education.
This is Michelle. I agree. I think that continued education and helping to support our local businesses the best we can if they're really struggling with it, opposed to trying to come down and really kind of force the issue. But I also defer a little bit to Brian on what you're seeing more than we are every day, and if that's enough.
I mean, honestly, it just went into effect as of yesterday, so I haven't really been out and about yet. But we will definitely monitor it, see how it's going. I am in complete agreement with you guys as to education and a discussion versus punitive and punishment type of situations.
I can chime in real quick. This is Steve. I actually was in Market Basket today, and in North Andover, obviously. And I will say, I'm pretty sure every customer I saw had a mask on and was pretty good about it. So I was just throwing that out there. I haven't been out too much, and I'm hoping to get out more, and so I can give more accurate information. But that's just as of today.
Yeah, we've done a lot of monitoring of employees since our mask order came out, just to make sure they were complying with it. And we've had several conversations with a few of the managers about being on top of their employees and making sure that their employees are complying with what you guys had implemented a couple weeks ago.
Right, Brian. It's Frank here. It's my understanding that if you find egregious violations, it's within your power to close a business, to order it closed, and then they have to come to the board to appeal to reopen. I mean, again, I'm not. I think we should tread as lightly as we can, but at the same time, it's not like there's no teeth. We don't want to use those teeth. Again, we don't want to criminalize being difficult, because it's okay to be difficult. We don't like it, but at the same time, if you find egregious violations, you can close it and have them appeal to the board
Yes.
if it comes to that.
Yep, absolutely.
I'd just like to talk for a moment on where we are right now. Let's only take a minute or two. The initial actions taken, such as stay-at-home orders, were primarily to help assure that the hospitals were not overloaded with Corona-19 cases. And these actions, they appear to have worked. But now, listening to the politicians, continuation of these actions, they say it's to prevent infections and death. That's exactly what Nancy Pelosi, the Speaker of the House, said several days ago. And I'm saying to myself, no, that's debatable at best, because until there is a cure, and there may never be a cure, we don't even have a cure for the cold. Okay, so there may never be a cure. But until then, assuming that there will be a cure someday, people who have not been infected can be infected and will die. So the actions that we're taking right now delay the time of infection and death, but they do not prevent infection and death. Because I know so many people who have not left their home at all. But when they leave a week, a month, a couple months from now, they can be exposed and die. So all we're doing is delaying exposure and death. We're not reducing death. Some of you, because many of you are obviously in the medical field, I am not, but if you feel different, please. But I just want to open up the country ASAP, because if we don't, it's going to be catastrophic from an environmental, probably not from an environmental, from an economical perspective. Catastrophic right now.
Joe, I think you're right, but I'm going to put a little nuance there. Is if we don't have everybody showing up to the hospital at the same time, the likelihood is that people will still catch the coronavirus, but they might not die of it. If everybody shows up at the same time and you get to crisis standards of care, then that comes a situation where, you start having to choose, like, who are you going to save and who are you going to, let go peacefully, which is it's a brutal decision. And none of us who are on the board, who work in the medical field, want to be confronted with that. But your point is very well taken. And again, I think that we're actually coming to a consensus here that we want to be as least intrusive as possible and as responsible as possible, not overstep, make sure that the public stays on our side, make sure that we're on the side of the public, and try to get through this together. But I think that there's a lot of sensitivity on this board to the business community. We know that they're hurting. We know that the pain is not being shared equally. I think we all want to get this thing opened up in a way that's safe and responsible. So again, well stated point. I pretty much agree with you with just a very small nuance.
Right. If you look at if looking at the Great Depression, unemployment reached 24.8%. In March, the unemployment rate in Massachusetts was 2.9. I heard on a TV news broadcast several days ago that the unemployment rate in Massachusetts is now in excess of 25%. I don't think it's that high, but I heard it on TV. But if it's not in excess of 25% now, it probably will be soon. It's going up exponentially. We have over 30 million Americans that aren't working. Some of them, they have no income at all. They can't even feed their family because the checks from the government are being delayed. How can we let this happen to this great country? What are we doing? Good Lord. If right now in the country, there's 73,000 deaths in the country. During the Spanish flu, 1918 and 19, in the United States, there was 675,000 deaths. almost 10 times as much. In the world, there were 50 to 100. And speaking of deaths, I mean, if you take a look at like the Battle of Stalingrad in World War II, only over 2 million German and Russians died in one battle, not even counting civilians. And here we're going apoplectic. U.S. deaths, 73,000, when millions of people die for other reasons in the United States every year. I'm fearful what our economy is going to look like next year this time, I tell you. I think it's going to be really, really bad, and we have no one but ourselves to blame. It's time to start up. So, thank you for listening.
Thank you, Joe.
Thanks, Joe. Good points. Anybody else want to comment? Hearing no other comments. Any further discussion for tonight?
Oh yeah, I'd like one comment. The minutes of the April the 23rd meeting have been critiqued, and I make a motion that they have approved.
Second.
Further discussion?
It's April 9th.
All right. It's been moved and seconded to.
It's April 9th is the last minutes that we have in front of us.
So the last set of minutes in front of us, April 9.
Yeah.
It's been moved and seconded to approve the meeting minutes of April 9. Is there further discussion on the minutes? Which can include deferring consideration to in the next meeting if you haven't had a chance to look at them.
I actually don't know if we, I think we received the April 9th, but we haven't received the subsequent one.
Correct. Yeah, you guys have the April 9th minutes before you right now.
Okay.
I thought it was the April the 23rd because I'm the first to get them, but I could be mistaken on that.
I don't think I've seen the 23rd minutes myself.
Yeah, me neither.
Yeah, I'm the first to get it, so it probably wasn't passed out.
All right. So what's before us is April 9. Does everybody feel that they've had a chance to look at them? And
I did see those.
It's in order to object if you haven't. All right. Hearing no objections, we'll move to a vote. Hearing no objections, we'll move to a vote on April 9. All in favor of accepting the minutes as distributed, say aye.
Aye.
Aye. Any opposed, say no. Okay, that's unanimous. All 5 members are in favor on a voice vote. The minutes are approved and April 9 is approved. Any further discussion before we close the meeting? Any communication announcements or anything of the like?
Any updates from the medical field, maybe? Just from what you guys are seeing from your practices, I'd just like to get a quick 1-minute blurb on, just from your perspective.
Frank, you want to go first?
No, go ahead. Go ahead, Patrick. I'll follow you.
So I was the intensive care unit rounder last week. I did a 7-day stretch. Our ICU is extremely busy. We have a 30-bed ICU, and we were packed, but only a very small proportion of patients were COVID patients. I think we're starting to see the sequelae of patients delaying seeking medical attention for other issues that are not COVID related, but the fear of seeking medical attention because of COVID. I definitely saw a fair amount of patients admitted last week to the ICU critically ill because of this. But our practice is already starting their plan to start seeing patients in the office. Over the next month, there'll be a month to 6 weeks or so, there'll be a shift of basically from 100% telephone or telehealth encounters to about 60% telehealth and 40% in office, with the goal of by the end of July into August, we'll be a switch of 60% in the office and 40% telehealth. So that's kind of where we're at this point.
Great. Thanks, man.
Good to know. So I practice a little bit north of the Massachusetts-New Hampshire border in Exeter. And so my hospital is 6 miles north of the border. We made the decision today to resume doing routine endoscopy. So screening and surveillance colonoscopy. You turn 50, you need a colonoscopy. You had a polyp in the past, you need a 3 to 5 year colonoscopy. So we're doing those again. We're evaluating reflux disease, things that were considered to be non-urgent. Last week, I saw a lady in the hospital who will go unnamed, who had some minor rectal bleeding, and did a scope on her and unfortunately found a cancer. Fortunately, there's been no delay and there's no evidence of metastatic disease. So my hope is that she'll do well, but it really kind of hits home the issue of delayed care, that people have been out there, they haven't been complaining. If they're not complaining, we don't know it. If we don't know it, we don't think to order the CAT scan or the procedure to make the diagnosis. And so where we are right now is we've started to reschedule. We started on April 27th to clear our high priority list, but we're finding about 40 to 50% of our surgical patients who we deem to be high priority at the beginning of the COVID crisis are afraid to come into the hospital. So what I can say is that we're testing everybody, but one of the roadblocks that we've run into is even with the testing, because the turnaround times, are sometimes 48 to 72 hours. We ask people to self-quarantine from the time of their test to the time of their procedure. And we're getting about half of our patients saying no, that they're not going to do that. So understanding human nature and all of that, we've actually got another test on board that turns around in 4 hours. But so still, those people will still need to come in for testing 4 hours before their procedure. And we haven't really decided, other than our screening at the door for the clinic patients. The clinic patients are having their temperature checked. They're doing they're putting masks on. They're getting a questionnaire, but they're not getting a genomic test or an antigen test or at the door, because it's just not, the point of care just isn't that fast yet. I expect it will be at some point, but we're still having a problem filling. We've opened up, but we can't fill our appointment slots because about half of our patients just won't come into a hospital anymore. So it's been a challenge, and we all worry about delayed care of non-COVID conditions that were there before, and that would have filled up our appointment schedules. And the cardiologists are seeing the same thing. They're like, where is all the heart disease going? Because we know that, a certain number of heart caths need to be done. And, are people just like living with unstable angina? I've seen things in the newspapers about, people are eating out less, and so they're getting less salt and fat. But, none of us really knows, is the disease prevalence gone down, or are we just like missing stuff in the community?
I actually heard a statistic recently that there's about 80,000 undiagnosed cancer cases out there within the U.S. That are going undiagnosed right now because of delayed care.
You said 80,000?
Yeah.
So maybe we should do something on getting back to preventative medicine. Get your checkups. Your doctors are back in their office. Call them up.
Just call your primary care doctor. A lot can be done by telehealth. I'd say 95% of what I can do by video, just by talking to patients.
Yeah.
And tests are available. I've sent people for CAT scans. I sent people for chest X-rays. It's available, and we do have that capability, but we don't know until we're contacted.
All right, so we'll work on something and getting some messaging out there, encouraging people to reach out to their doctors for stuff that they've put off for the last 2 months because they're afraid to go to their doctor. I think it's a great idea. So we'll work on that starting tomorrow.
Yeah, Brian, there's just, if you kind of think about the cancers that kill people, not all cancers kill people, but the ones that do, lung cancer are number one cause of cancer death in the United States. Number 2 and 3 are breast and prostate, and closely thereafter is colorectal cancer, and then pancreas cancer kind of rounds it out. And then you got things like melanoma and things like that. So these are things that are not getting diagnosed, and that they're eminently they're findable at early stage. So people who are delaying care, as Patrick said, these we're open for business. Imaging is available. Um, office appointments, whether they're virtual or they're physical. Virtual visits are almost as good. And, if you have questions or concerns, you can do a virtual visit. You can take your time, but at least make sure that you're heard and you get an expert opinion, whether it's okay to defer or whether it's something you need to have addressed now.
Okay.
But we're all concerned about the last 8 to 10 weeks where we've been doing no work.
Okay. No, that's a great idea. Thank you.
I will say I had a telehealth visit yesterday and it was a wonderful experience.
Thanks, Michelle. All right. No, that's awesome. I definitely appreciate that.
All right, so the night is getting a little bit long in the tooth, so to speak. It's now 8:15. We've got an hour and 15 minutes. We've gone 15 minutes over our allotted time. I will entertain any closing thoughts from anybody who has a point to make. If not, we will close the meeting.
I'll make a motion to adjourn.
So it has been moved to adjourn. Is there a second?
A second.
Second from Michelle, moved by Patrick. Moved and seconded. All in favor of adjourning, say aye.
Aye.
Hi.
Any opposed, say no. The ayes have it unanimously. The meeting is now adjourned. Thank you again, everybody.
Thank
Good
you.
night, everyone.
See you guys in a few weeks.
Thank you.
All right. Again.